At the KSMO studios, we're welcoming in the latest family nurse practitioner at SMDH Family Clinic. It's Sam. Yay!
Good morning.
How you doing, Sam?
Good. How are you?
Did you have a good holiday?
I did.
Great.
How about
Oh, fantastic. So, how's it like? I mean, you're from around here. How's it like working and seeing people you know every single day?
you? I love it. I love being close to home.
Okay.
7 minutes from my house.
Mhm.
It's amazing.
So, anybody that thinks, first off, let's explain what a family nurse practitioner is. Because I think, we hear the FNP designation all the time, and I think a lot of people go, I don't know who it is, but they wrote me a prescription. So, can you explain what a family nurse practitioner is?
So basically, I'm a primary care provider
Okay.
that deals with acute illness, chronic illness, wellness. So basically, I'm a registered nurse, but I have a master's degree, and I'm able to provide care for patients in the clinic. So
You're not a doctor.
I'm not a doctor, no.
But you're kind of just a step below that.
Right.
Okay.
Right.
So you can diagnose things, you can write those prescriptions, and then if there's anything that you can't make a decision on that a doctor would, then you confer with the doctors that we have on staff at SMDH Family Clinic.
Yes, that's absolutely correct.
Okay, so
Yeah.
there's the cohesiveness of family even within the hospital family. Because you
Yes.
really all have to work together.
Yes, we do. All of us. We're all a team. We all see patients, so, yeah.
So what facilitated the idea to become a nurse practitioner?
Actually, it has been a dream of mine since I was little.
Really? I did not know that. That's news.
Yeah, so I always wanted to be a nurse. I got my LPN, then I got my RN, got my bachelor's, and then I went on and got my master's. But yeah, it's been a dream of mine since I was little. I knew that I wanted to work with pediatrics or kids, but I also wanted to be able to help adults with their health as well. So being a family nurse practitioner, I can see all
Everybody,
ages, and that kind of helps, put that dream together, I guess.
And kind of with the lack of pediatricians and some of the other hospitals around there used to be just specializing in children.
Right.
You fit a need right now that there's a lot of people who had pediatricians and they're no longer around.
Absolutely.
So if somebody has that need, they can just call and set up a time and designate. And they can just say, "Hey, give me Sam,"
Yep.
and Sam, or I'd like to see Sam and see what she can do, and that's when that's your time to shine, girl.
Absolutely. And I love seeing kids. I mean, I love my adult patients as well,
Sure.
but I really enjoy seeing kids too because they are a whole different realm in the medical field.
So when you've started out, as you mentioned, with your LPN, you've seen a whole gambit of different things and different experiences from the nursing side now into the nurse practitioner side, haven't you?
Yes. Yep. I have, let's see, this will be
Don't give away your age.
12 years of being a nurse, I think. 12? That's right, yeah. 12 years being in the medical field and working night shift, working day shift, seeing hospital patients. Yeah.
And what departments did you work in as a nurse?
So I have ICU experience. My main thing that I did was medical surgicals. So like it'd be bedside hospital patients, but they have anything going on. My most time was spent on a medical oncology floor. So I got to see the medical side, being pneumonia, whatever, abdominal pain, to patients with cancer and taking care of them as well.
So one advantage you have over maybe just a doctor is that you've seen the nursing side. You know what the nurses are going through when they're working with you. You know exactly what's expected of them. They don't know what's expected of you, but sometimes a full doctor doesn't really have that nursing experience to where they understand what that nurse has to do and follow up with being a doctor. They just
Right.
give it to the nurse and then they're off to the next
Right.
patient, where you understand, hey, this is what I need you to do. Can you follow up on that and let me know what's going on?
Yes. Yep, that's 100% correct. Yep.
It's nice to have that communication with nurses and be able to be on their level and know
Yes.
exactly what's
Yeah.
going on.
Yeah.
Pretty nifty stuff. So how has the clinic been? I mean, we've got the Saturday days now, 9 to 2 now. You worked a few Saturdays yet? Or?
I have not. My first one is February 11th.
Okay.
So far it's going well. We were closed the weekend of Christmas, but we have been open every weekend in December besides that one. And then obviously this Saturday will be open from 9 to 2. And it's going well.
And it's a walk-in clinic.
It's a walk-in clinic. You don't have to call. You can just come by and be seen. So there's one provider and their nurse there and the receptionist. And obviously, once you walk in, we'll get you taken care of, whatever needs to be done.
Okay, so if you're ill, feeling ill, if you just something goes wrong, you have something that you're not quite sure of. Instead of going to the emergency room and sitting there and going through that process, and nobody wants to go to the emergency room. I know I never did. But going to the clinic is just so much easier, and then they can take a look at it. If you do need to be admitted or you do need to go down to the emergency room, you're 200 steps away.
Exactly. Yeah, so that's the whole goal, is to hopefully those acute illnesses like influenza, gastroenteritis or the stomach bug, that type of thing, is to hopefully treat them in the clinic so it will help them not have that ER bill. Now, obviously, if it's an emergency, we want them to go to the emergency room.
Sure.
But, an acute illness and they're just not feeling well, we're happy to see them.
One of the things that, and I know that you probably see this all the time, but being as a plebeian out here, I don't get a chance to see all this. But a lot of people do ignore symptoms when they get ill, and they kind of let them go. Oh, I just have a cold, or I just have the flu. And the next thing you know, they have an inner ear infection, or they have a sinus infection. And they keep letting it go, and it just gets worse and worse. Do you see a lot of that happening still?
Yes. A lot of patients, and I get some people don't want to be tested or whatever, but influenza, COVID, RSV, that can all turn to pneumonia or inner ear infections.
Sure.
And, the longer they put it off, the less time we have to treat that. And, it could cause them to be hospitalized if it gets too bad.
Yeah.
So.
Yeah, I had an issue when I was in college. I was with the hockey team there, and we took off, and my ear popped, and I didn't think too much about it, because, your ear pops, but it popped. I mean, it really went. And so we were flying to Marquette, Michigan. I got up there, and all of a sudden, I started having cold-like symptoms, and, I was just miserable, and I didn't really think too much about the ear, but I was just miserable for the whole weekend. We flew back, and then I never, ever could get over this, what I thought was a cold. For a month and a half, I fought this thing. It got better, got worse, got better, got worse. Finally, I went to the clinic at the university, and the guy looked at my ear, and he goes, "What the heck?" And I said, "What?" He goes, "You've got a massive inner ear infection." And I thought, "Massive?" He goes, "Well, yeah, like you blew your ear out in a plane." I said, "Well, actually, I kind of did." He goes, "What took so long?" And I said, "Well, I thought I just had a cold." These things can happen, and then by the time, and the antibiotic he had to give me was super strong, because he goes, "You've let this go for so long, it's really everywhere." He goes, I'm going to prescribe you this. You don't take it more than these 5 days. That's it.
Right.
And so he gave it to me, and yeah, it was within, 3 days, I felt fantastic.
Yeah.
And within a week, I was ready to go dance my heart away and have a good time. But these are the things that we don't think of that can happen to us all the time.
Right.
Get that inner ear infection, get that sinus infection. You can get an infection, a skin infection, by getting a scratch.
Yep.
We see this stuff happen all the time, where we don't think too much about it. We let it go, and then by the time we get a chance to treat it, it may be at an advanced level, right?
Exactly. Yep. And pneumonia is a big thing with, a lot of viruses or that type of thing. And when you get pneumonia, that really gets you down. So, but the inner ear infections, Just don't put it off just because you think you can get over it, because not always can you get over it. And you do need that little extra support with an antibiotic to help you.
Let me just ask you a question. Since you've been in the medical field 12 years, you've gone through the nursing, now into family nurse practitioner. COVID played havoc with everybody, and it really has kind of changed the medical scene, hasn't it?
It has. It really has. So actually, I graduated from nurse practitioner school in 2019. And then that was in August. And then I got my first nurse practitioner job in March of 2020.
Oh, boy.
Which is when COVID
Yeah.
hit. And so starting out as a brand new nurse practitioner in the midst of COVID was insane. Like, it was insane.
It had to be uncomfortable, though.
It was, yeah, because in the beginning, one person I could see and I could test them and they'd be negative. And then the next person I would not think would have COVID and they tested positive. And then once the extra variants started coming out, it was a little bit easier to be like, oh yeah, you definitely have COVID. But it just made it tough because a lot of people didn't want to come in for their wellness exams, and that's super important.
It is.
So
It really is. And one of the things that, because of, I think COVID started scaring people away was from vaccines, because oh my gosh, they just came out as vaccine out of nowhere. It's not going to work, or it is going to work, however you want to feel about it.
Right.
It's a vaccination. It's not going to keep you from ever getting COVID, but it will reduce the effects of it. It's just like a flu shot.
Yep.
It's just like measles. You get a measles shot. Doesn't mean you're never going to get measles. It just reduces any of the symptoms and how it attacks your system.
Exactly.
And then we see people. I mean, I was at University of Illinois here, 4 years ago, had that measles outbreak because everybody stopped getting their measles injections to keep that from them getting it, and especially in a college setting.
Right.
There's a reason for some of these, and it wasn't that measles was eradicated. It's still there. It's just not coming out. It's not spreading. But when you give it an opportunity to spread, it will.
Oh, yes, it definitely will.
And if you're unprotected, it will. It will attack your system. And the older you get with measles, the worse it is.
Yep, absolutely.
I've been getting to latter stages of the parts of your life that you realize that sometimes a vaccine's not a bad thing. You definitely want to make sure that you take care of yourself. I myself got a booster, COVID booster, and a flu shot. And I still need another shingle shot. I still need my pneumonia shot.
Get that too.
But you can't. Well, I think what people understand is you just can't get all those at one time. You have to leave a little breathing room in between. You got to let your body recover, and then it'll get to the next vaccine. Usually 28 to 35 days, they said, to the next shot. So, well, we've got that one done. Now we got to wait a little while. We'll get the next one, and we'll get the next one.
Right.
But don't put off things. I mean, if somebody said, well, I'm not going to get shingles. Did you have chicken pox? You may not know you have shingles, and it can be a very minute little spot that comes up to a full-fledged outbreak. And you don't want that full-fledged outbreak because it takes sometimes months to clear up.
Yes. Yep. And I've actually seen quite a few cases of shingles lately. And the postherpetic neuralgia, which is the lasting effects of the nerve pain from it, really affects some people. Some people don't get it, and they clear up from shingles super easy, but other people do. But the shingles vaccine is super important, especially in the older generation, just because.
You recommend 50 and older or up to 60?
60 and older. 60, 65.
I've seen a lot more people in their 50s getting shingles.
Yeah, I've seen a lot of younger people lately getting it, likely related to their, immune systems being down, and it's just coming out of its
hibernation,
basically. Yeah.
It really, if you have chicken pox, it's in you.
It is. It lies dormant in your body, and any type of stress or when you're immunosuppressed or immunocompetent, that can cause shingles to outbreak. And I
Well,
can tell you, it's painful. I
well,
had it at 24.
okay. So you know exactly where we're coming from.
Yeah,
Those shingle
exactly.
shots are important. You
Yep.
don't want to be going through this, especially in latter stages of your life where 65, 70, and that could take a long time for you to heal because you're not as active.
Right.
And your metabolism isn't quite as gusto as it used to be when
Right.
you were 25.
Right.
And, you know, a lot of times I always felt that as a younger person, I could get over something pretty quick because I was always active. You know, being an athlete, I always felt that helped because if you know our coach didn't give us a day off for the flu, you're out there.
Right.
You're practicing with the flu. It doesn't make any difference. You'll get over it. Cough it out. Get it done. You know, that may not be the best medical advice. Okay.
The whole team will have it.
Well, you know, they would pretty well quarantine you, but they'd put you out there in your equipment and practice, and then when they got it back, you know, the training staff would all throw it in the washer and next day you're right back out there again.
Right.
But it's one of those things that it's not laughable. I think a lot of people, you know, we got a little bit smarter as we've gone through the years. Now I'm talking back in the 70s. You didn't think about things like that.
Right.
You know, yeah, okay, you got the flu. They gave you an 8-foot barrier pretty much. You didn't see anybody within 8 feet. You went and showered by yourself, you know, and you did the different things by yourself. Okay, get that. They'd take your equipment, they'd take your stuff and wash it by itself.
Right.
They knew that part. That was all good and dandy. But then we get on the same bus.
That makes a lot of sense.
Well,
Yeah.
you know, just in your head.
Right.
You know, you're taking the right precautions, and then why are you taking me on the trip?
Right.
Well, we might need you. You know, well, okay, you're going to get everybody else sick. Well, potentially. But then they, you know, pretty well they would keep you in the front seat and you stay there. You don't move. You don't socialize. You don't go back. You don't take the cans out of the cooler to pass on to your team. You just sit right there.
Right.
I mean, they're smart enough.
Right.
But you're still there.
Yeah.
Right?
Right.
That's kind of crazy.
It is.
But that's how it used to be. Now
Right.
today, we're a little bit smarter about the different things. You know, hand washing's still the best way.
Absolutely.
Don't touch your eyes. Don't touch your nose. Don't touch your mouth.
mouth.
Don't put things in your mouth when you haven't washed your hands. So that includes eating.
Yes.
You
yes.
know, wash your hands before you eat. Does that sound weird? Well, maybe. I always wash my hands after I eat, but wash it before you eat.
Right. Right. That's the biggest way to prevent spread of infection, spread of viruses. Wash your hands. Use hand sanitizer, but also wash your hands. 20 seconds, hot soap or hot water and soap, and that's the best way to keep things down.
And get the whole hand, not just the
Yep.
palms,
All the
in
way up
between
to
the
the
fingers
wrist.
and on the wrist. Give yourself a good washing, and it really still is the best solution
Yep.
to staying as healthy as possible.
Absolutely. I ingrain that in my kids' heads.
Yeah. And it's a good thing. And once you get used to it, but you know, when COVID hit, I think a lot of people followed that advice: hand sanitizer, washing their hands, and then they say, well, you know, we're kind of past that. And then you see people kind of forget all that anymore,
Right.
and go right back out, and they're touching things, and then. Especially with holidays, we saw it happen Thanksgiving. All of a sudden, a little ramp up, and
Right.
you know, families visiting families, you don't know you're sick, and the next thing you know, you spread.
Absolutely.
And it doesn't take much.
Yeah.
And a lot of times when people are traveling, and I know this for a fact, you get on the airplane or something of that nature, you don't think you're touching anything. You're grabbing onto this, you're grabbing onto that, you're holding your touching the counter, you're sitting down in a seat. Who else has sat in that seat?
Right.
How many times have they sat in that seat? You know, or you go to the counter, go to the restroom, whatever it might be, you're touching different surfaces all the time. Are you taking the precautions to stay healthy?
Yeah. Yep.
Most
That's
of us
exactly
probably
right.
don't.
No,
know.
it's crazy. And I think that that's the biggest thing is people don't realize that everything you touch has germs on it.
Mm-hmm.
Because the person before you that touched it probably didn't wash their hands.
Well, probably. But even if they did, let's say for a grocery store. I know one time I got very ill after going to a grocery store. You take a can off, you look at it, and you put it back on the shelf. Okay, whatever you had on your hand is now on that can.
Exactly.
All right, so then you come by, you're the next person, and you take that can and you put it in your basket, and then you get home and you put all your food away, Then you prepare food. Did you wash your hands?
Probably not.
Probably
Because
not.
you're at home and you don't think
Probably
about
not.
it.
You don't think about it.
Right.
So one time I actually put in hand sanitizer right in my car. So as soon as I got in the car, a hand sanitizer went on. Then I'd go unload the groceries, and then I wash my hands.
Right. Yep.
And then when I go to eat the food and prepare it, I take the can out, put it in, I wash my hands before I eat.
Yes.
So I'm not trying to tell anybody how to live your life. You live it the way you want. But if you
Yep.
want to try and avoid a lot of the very simple things that you see people get, colds, the flu can get passed on so easy, RSV's out there, COVID's out there still. It's a different type of COVID, but it's still COVID.
Yep. Yep.
What do we do? What do we do, Sam, to save the world?
I wish I knew.
Yeah.
I wish I knew.
But if we did all that, you guys wouldn't have any business. So
Yeah.
here's the thing. If you are ill, feeling ill, if you need a physical, or if you need just maybe you got a rash of some kind,
Yep.
people think, oh, that's nothing. That's no big deal. I'm going to tell you something, and I know you might know this for a fact, but other people, I'm very allergic to poison ivy.
Yep.
Okay.
I see
All
that
right.
a lot.
Okay. People think that once you're past the summer season, poison ivy's over. It's in your system forever, especially if you get it bad. And then in the middle of winter, you may have a bump show up.
Yep.
And guess what? It's poison ivy.
Yeah.
Now, you can handle it a number of different ways. You can sit there and scratch it, and usually that type doesn't spread much, but it's irritating. It has the poison ivy itch. It comes up. It's unsightly. It's not pretty, and it drives you crazy. And usually in an area you can't scratch if you want it to.
Right. Right.
So you treat it, just let it go, get over it, and keep going. But if it's bad enough, if it does spread, maybe it comes out in 5 or 6 locations, get over to the clinic and get yourself a shot.
Yes.
Maybe something activated that. I was out in the air because poison ivy can travel in the air.
Yep.
It can do it. Somebody might have burned some wood that had poison ivy still on it while you were driving or going by, driving by, walking by, whatever, on your way to church. Didn't even know it, but that poison ivy was on that wood and that sap was, and they burnt it. And guess what?
Now it's in the air.
Now it's in the air. Now you got it.
Yep.
So these things, we don't ever think about that, do we?
No. No. That's the biggest thing I see. A lot of people, I burned brush and now I think I have poison ivy all over my face. Well, likely.
Yeah.
Or poison oak or sumac, whatever it may be, but it came from you burning brush.
Right. So, and it can happen at any time as long as there's active oil.
Yep.
It can affect you, and especially if you're very allergic to it. The one thing you don't want to do in burning that is to breathe it in because you can actually internally get poison ivy
Yes.
as well, right?
Yep.
That's not good. I don't think
No.
I don't think I've ever had that. And I don't want to, but
No.
it is something I think people need to be very well aware of. So there are conditions. Don't ignore things when they're out of the norm. Don't ignore it.
Yes, please don't ignore it.
It's easy to make a phone call just to go see a family nurse practitioner who's dying to meet you.
Yes, I am. Please come see me.
All right, 729-8000 at the clinic.
Yes.
And your days that you work?
So I am there Tuesday 8 to 6,
Okay.
Wednesday 8 to noon, Thursday 8 to 6, Friday 8 to noon.
And Saturday, February 11th from 9 to 2.
Exactly.
Now you also are, the hospital just signed a contract with our local jail.
Yep.
You're providing some services there as well, correct?
I am. That actually starts today. I will get to go over there and see patients at the jail. That's why I'm only in the clinic till noon on Wednesdays and Fridays because I
Okay.
will be the provider at the jail.
Very good. Well, congratulations on that.
Thank you.
And we're pleased as punch to have you on board. And you're the latest addition, but you're very familiar with this hospital and everything
am.
else. So this isn't anything new to you, but we do appreciate you coming back and being part of our SMDH family clinic over there. You guys do a tremendous job, and we look forward to having you for many years, Sam.
Yes, thank you. I'm glad to be back home.
Very good. Again, 729-8000, and ask for Samantha Welch, our family nurse practitioner.
Yes.
And
Please.
she would love to see you. And if you have any questions about that, feel free and to leave a message, and she can get back to you.
Yep.
You know.
And also, I'll throw out there, I do DOT physicals.
Okay.
So all you truck drivers out there, come see me, get your DOT physical. Don't let it expire.
There's the key word right there. Don't let it expire. Key words, I should say.
Yes.
Very good.
Yeah.
All right. Well, Sam, thank you very much for coming in and spending some time with us. And again, 729-8000. SMDH Family Clinic is located in Physician's Office Building 3. That's the first building you see when you're driving by on 72, the closest one to the hospital.
Yep.
And feel free to give her a call and set up a time. It makes
Yeah.
it easier when you have appointments. You don't have to make appointments.
Nope. We do accept walk-ins. You can walk in anytime. You may have to wait a little bit if we have other people scheduled, but any of us are happy to see you as a walk-in. If you want a specific provider, you'll have to ask for them. But 729-8000 is the number to make an appointment if you want to make an appointment.
Thank you, Sam. Appreciate it.
You're welcome. Thank you for having me.
Stick around. Civic Happenings next.
Southtown Furniture in Salem is kicking off the new year with a Serta Perfect Sleeper mattress sale. Right now, you can save from $50 to $100